Now, one of the people you've spoken with while you were over there was Madeline O'Donoghue from SpeeDx. So what can you tell us about SpeeDx and this idea of resistance-guided therapy?
Well, SpeeDx is an Australian-based company, and they specialize in producing diagnostic technology. So that's really all about being able to test and identify the presence of particular types of STIs. Now, when it comes to the resistance-guided therapy, this is a fairly emerging field. And it's not just about the ability to detect whether somebody has an STI or not, but it's also to look at identifying whether their particular STI is resistant to standard antibiotic treatments within their infection, or whether it's also susceptible to different types of antibiotic treatments. So therefore, that means that as a result of running these tests, we can work out if an STI is present and also what kind of treatment is going to be the best kind of treatment personalized for that individual to treat them in future. There's some really good benefits in terms of why they might do that, and I think we might unpack that later.
Okay, well, let's have a listen to part of that conversation between you and Madeline.
So we've heard a lot about gonorrhea becoming increasingly resistant to those first-line antibiotic treatments. What is the consequence of that, and how can resistance-guided therapy be useful here?
So that's a typical pattern, and you can see right from the very beginning that every treatment we've used with gonorrhea has developed ultimately resistance towards that treatment, and that's just an evolutionary arms race that we have with this disease and with this organism. What we're trying to do is change that empiric treatment, change that automatic choice of that frontline therapy, and replace that with a guided approach so that the clinician can see that you have gonorrhea, they can understand whether or not that gonorrhea may be resistant to the treatment that they were going to use, and now they can have a choice to not use that and potentially perpetuate resistance by using the incorrect treatment.
Right, so I've heard there's an older antibiotic called ciprofloxacin that was also used to be used to treat gonorrhea. So why did we stop using that, and what's the benefit of going back to it?
So ciprofloxacin was the frontline treatment, and it was used as a blanket therapy for gonorrhea, and it's a very effective drug. It's a really easy to take drug. It's an oral single dose tablet, very beneficial for both the doctor and the patient. But what happens is when you have a drug in circulation in the population, the disease is ultimately going to get resistance generated to that, and that's exactly what happened with ciprofloxacin. So once resistance reaches a certain level within the population, the guidelines change so as not to perpetuate and create an untreatable infection. Because ciprofloxacin has been out of circulation for a number of years now, what we're finding with our general surveillance of gonorrhea infections is that approximately 70% of gonorrhea infections are actually still susceptible to this drug now. There's no selection pressure in the population for it to continue developing or maintaining resistance to the drug it's not being exposed to anymore. So this is a really great opportunity for us to develop a diagnostic that can guide the clinician to reuse some of these older antibiotics, and they may well be effective. But the key is that the clinician has to know that that drug is going to be effective before they're allowed to use it, and that's what our diagnostic can do.
So what I'm picking up from that is that really gives the clinician the opportunity to create a personalised treatment plan for the individual based upon whether their particular infection is going to respond to that particular type of treatment.
Absolutely. And it is all about making sure that with that specific infection that you're treating it appropriately and not just blindly going to that last line, and it actually is the last line therapy that we're using as the frontline treatment, which is terrifying because we really want to make sure that we can utilise the drugs that we have available now and use them much more smartly. There are drugs in the pipeline, they will be coming out, but they're not here now, and so we have to use the tools that we have now more smartly.
Okay, Chris, so you unpacked quite a bit there with Madeline. I'm just going to get this correct. So basically what you're talking about is a way of diagnosing, that if you've got gonorrhea, it's a way of finding out, what's old is new again. You can use an older form because gonorrhea has evolved and basically regained a vulnerability that it sort of had in the past?
Yeah, that's exactly right. And now we can utilize that vulnerability to make our treatment options significantly more effective, as long as we're able to identify in the first place whether each person's gonorrhea infection who has gonorrhea is going to respond to that particular treatment or not. So it's a really smart way of approaching treatment.
So this is really interesting because, we've heard about drug-resistant gonorrhea before. I think that Emanate may have even covered it. And a lot of people think, oh my gosh, well, the only way is forward. But it's interesting to think that actually one of the way forward is by accessing something from the past.
That's right. Who would have thought that?
Yeah, that's fantastic. And the conversation with Madeline beyond that, I guess, has it gone beyond gonorrhea?
Yeah, look, so to my knowledge at the moment, SpeeDx have also done some work in another STI, which is called Mycoplasma genitalium, or MGen for short. Now, they do have some diagnostic tests that are able to work out whether this is present and also its resistance or susceptibility to other types of treatment. So this is really indicative of maybe this kind of resistance-guided therapy is something that we could be seeing a lot more of in the future, and it potentially has great applications for use in diagnosing and treating other STIs as well. Fortunately, in terms of chlamydia and syphilis, we're not really seeing huge amounts of resistance, to my knowledge, in those particular STIs, or certainly not at the same rate that we're seeing gonorrhea. So therefore, we're totally putting our efforts in the right area in terms of what the priority STIs are right now.